Assalamu alaikum. The article for this week is titled as Expression of Selected Inflammatory Mediators with Different Clinical Characteristic of Pulpal Inflammation. This clinical study done by Muhammad Sabeti with others and Ashraf Fuad, published in JOE in 2023. Proteins in the pulp can be used as a biomarker to determine the condition of inflammation accurately and predict its ability to survive vital pulp therapy. The determination of levels of specific proteins may eventually give rise to the development of point-of-care tests that help the clinician to predictably diagnose the status of the pulp and predict the long-term prognosis of treatment. This study aimed to determine the concentration of specific inflammatory mediators in the dental pulp of mature teeth with carious pulp exposure. 34 adult patients with fully developed teeth were included, and the study patients were clinically determined to have either reversible or symptomatic and asymptomatic irreversible pulpitis, with the requirement that no prior pulp therapy had been conducted on the affected tooth. And other exclusion criteria for this investigation included patients with any chronic systemic disease, patients on immunosuppressive medications, teeth with necrotic pulp, and also teeth with the previously initiated pulpal or endodontic treatment, and teeth with radiographic evidence of periapical lesion, root resorption or root perforation, and or root fracture. The study samples were divided into three groups. Group 1 included peripheral blood from 5 healthy volunteer patients and was used as the control group. And the group 2 included blood from teeth with a diagnosis of irreversible pulpitis. And for this group, the teeth presented with the immediate non-lingering pain upon thermal testing, and these teeth exhibited no signs of pulp exposure or infection upon clinical and radiographic evaluation. To adequately restore the teeth within group 2, prosthodontically, the teeth were scheduled for root canal procedure. And for group 3, consisted of teeth that were diagnosed clinically with symptomatic and asymptomatic irreversible pulpitis, and the teeth with this group were characterized by lingering pain in response to thermal test, as well as spontaneous pain, and these teeth were also scheduled for root canal treatment. Clinical and radiographical examination of these teeth demonstrated severely deep carious lesion approximating the pulp. Onset of the pain, spontaneous with biting or cold or hot. Duration of the pain after application of a cotton pellet with endo ice were recorded. Also quality of the pain were recorded. Any medication taken for the pain, either medication type, dose, and duration also were recorded, and its effectiveness also was recorded. In addition to that, the bleeding time upon pulpal expose was also recorded. Regarding the sample collection, following the exposure of the dental pulp, 40 microliters of blood from the pulp were gathered using microcapillary tubes, and then the root canal procedure and build-up was completed. Samples were tested using the Luminix assay platform. The Luminix instrument, when paired with the multiplex assays, is favored due to its multiplexing ability, adaptability, and high precision and accuracy, and its efficiency in terms of time and sample volume. 12 inflammatory proteins of interest for the study of inflammatory cytokines and protein biomarkers in different stages of endodontic inflammation consisted of interleukin 1 alpha, interleukin beta, interleukin 2, interleukin 4, 6, 8, and interleukin 10. Also, tumor necrosis factor alpha and transforming growth factor beta, and in addition to that, the metalloproteinase 1, 2, and 9. For the result, there was a significant positive relationship between presenting pain score and interleukin 1 alpha, interleukin 6, and interleukin 8, with no correlation was observed between other cytokines and presenting pain scores. The expression level of interleukin 1 alpha was significantly higher in individuals who had taken analgesic medications. Other inflammatory proteins did not show any difference. None of the inflammatory proteins tested exhibited any difference between the two groups in palpation for the pain. The expression of level of interleukin 8 was significantly higher in individuals who had pain to percussion, and none of the proteins showed any difference between the two groups for the bleeding time. The expression level of interleukin 1 alpha was significantly higher in individuals who had pain to cold test, and also was higher in individuals who experience spontaneous pain and nocturnal pain. The expression level of interleukin 4 was significantly lower in individuals who experienced nocturnal pain, with no other protein show any difference in pulpal diagnosis. In conclusion, the expression of inflammatory cytokines, particularly interleukin 1 alpha and interleukin 6 and 8, were significantly associated with various parameters of pulpal inflammation and result in pain. Monitoring these inflammatory mediators offers insight into the severity and the stage of pulpal inflammation and can potentially guide therapeutic intervention. And thank you.